Hi all, welcome back to Nursing Guru. Today we are going to start our class which is related to the applied nutrition and dietetics. So I am Swarnashri. I'm a nursing tutor over here, and this is Preeti ma'am. She's also going to teach you today about this nutrition and dietetics. Welcome ma'am.
Thank you.
So today we are going to spoke about the applied nutrition and dietetics. So first one by one we can go. Okay. So in this live we are offering you to chat with us. Okay. So 10 to 15 minutes I will give you at last for the discussion only. Okay. Whatever the doubts you have, you can clarify those things. Okay. So why? Because ma'am, we know that, right? We have lot of doubts when we are studying, right? No. So to avoid those confusions, how to tackle the examination as a fresher. Okay, so I'm telling about the freshers only. We are focusing more on the fresher students and who are failing multiple times in the examination. So for them, these are the strategies what we are going to discuss today's class. Those are going to be helpful for your future and get pass in the examinations. Okay, so hope you guys are study all the things and you're waiting for the classes right now. So if you are ready means our voice is audible means kindly tell about the things in the live chat and we will start up the classes. Okay. Okay. Am I audible to all?
Yes.
Am I audible? Listen. So okay, so today already I have discussed about the things what we are going to discuss and all. So here in this particular video, hardly it will take 1 hour only. Have a tea with along with this class and listen to this class. Okay, we are not going to waste your time and we are not going to supposed to make you to be feel that hurry worried. After listening to this class, definitely you are going to be get a clarity and as well as important questions for the tomorrow exam. Okay, so most of the questions will come from this particular class only. Why? Because we are predicting the most important questions that we can able to expect in the next upcoming exam, means tomorrow's exam. So first and foremost thing for everyone, I would like to tell that what you want to tell about the examination. They have to reduce the fear.
Fear, stress.
Yeah, so that is why they have to reduce the fear and stress. So what will happen over here? So first exam, pray with God and have a confidence within you and don't have any fear that
and
I
panic.
will, yeah, don't be panic. Okay, so you have to do the things which is that should not be panic, should not be going to be worried about your examination whether I will remember or not. So definitely you will remember, my dear students. So why? Because you know you have studied a lot along these days, right? So why you will going to be forgot. Okay, so let us start. Hi Naveen, hi, what are you doing? Have you studied? Okay, so before going to waste time, I would like to start the classes. Okay, so madam, you see that we know already we have designed, right? So
Yes.
this is the syllabus review. Total number of
units. 12 units are there in the syllabus.
Okay, so in the nutrition we have the 12 units. So in that particular 12 units, how those units you can able to recall in a one shot, that is the task right now. Okay, so that we can do it. Yeah. So we will start the unit wise discussion, madam. So
Yes.
here you can see that the introduction to nutrition, the first unit. Okay, so what you are supposed to going to think about in this particular unit, you can remember the things which is related to
nutrition.
So what is nutrition? What are nutrients? And what is the thing which is there in macronutrients means what?
Micronutrients and definitions.
So
And what
most
are the
of
types?
most of the thing which we can able to study over here is that which is about the nutrition
Nutrition.
only. Okay, so what are the effects of it, what are the aims of nutrition, what is the thing which we can able to, means what type of nutrition we will get. Okay, so different types will be there. Okay, so from different types of foods, what kind of nutritious things our body is going to be get. Okay, so and one more thing I would like to tell, first I will give the syllabus review. Okay, listen to that, and after that we can go with the question paper pattern even. Okay, so first unit is introduction to nutrition, later we will come and give a brief explanation about that, so that will make sure you to be get the revision. Okay, so you can able to revise it. Okay now, so here who are not yet joined, kindly join to the live sessions. Okay, so here the carbohydrates. Okay, so the next unit is carbohydrates. Okay, so carbohydrates are nothing but the starch. Okay, so that with the synthesis, metabolism, everything we are going to be see here. Okay, so the composition, the starch and sugar and cellulose. Okay, so different types of carbohydrates, monosaccharides, polysaccharides, disaccharides, oligosaccharides. Okay, so these are the things we are going to study. Then recommended daily allowances, RDA. This is very very important in the examination. There is a chance to ask about the expand RDA for 2 marks questions or multiple choice questions, or explain about the RDA, recommended daily allowances. Okay, so next one is dietary sources of the carbohydrates. Where we will get the dietary sources? We know that sugar, or we are getting from the rice. Okay, so these are the most important things you have to know. What are the functions? Okay, which will provide the energy, which will maintains the metabolism. Okay, so different functions which will be which is going to be performed. Okay, so that is all about the carbohydrates. Next one is proteins, fats, vitamins. Okay, so before going to that one, we have one more unit. So yes, proteins. Okay, so the third unit is proteins. So in that
proteins are the body building agents.
Yeah, body building agents, and which is the antibodies.
Amino acids.
Yeah, which is made up of the amino acids, and which is mainly we are going to see about the 8 essential amino acids over here, and protein synthesis, that is very important, and digestion and absorption of the proteins in the metabolism. Okay, so that is what is metabolism, my dear students. So that is the process of together process of a catabolism and anabolism. We will call it as a metabolism. Okay, next thing is proteins. Okay, so in that what we are going to study? We are going to study
8 essential amino acids.
So we are going to study about the 8 essential amino acids, compositions, functions of the protein is very important, and dietary sources, and protein requirements. That is also RDA. Okay, so RDA is a very important recommended daily allowances. Okay, so we need 30 grams of proteins per every day about your calorie. Okay, so about your weight of the body. Okay, normal human being needs to, means who wants to increase the weight of a lean person, the healthy human being needs a 30% or 30 grams of proteins every day. Okay, so the next one is fats. Okay, so in that fats we are going to study about the classification of saturated and unsaturated fats, calorie value. Okay, and next one functions of the fats, and dietary sources of the fats and fatty acids, and fat requirement, RDA. Okay, which means that is what RDA, recommended daily allowances. Okay, so in that dietary sources of the fats. Okay, so that is what fat oils. Okay, oils are the, for example I'm telling, remember. Okay, recall that like this. Okay,
sources.
Yeah, next thing, that
functions.
Yeah, functions of the fats. Okay, so the functions of the fats
brain development.
It helps in the brain development and all. Those are the functions that we can discuss in detail when it comes to the fat. Okay, next one is vitamins. Vitamins, two classification is there, water soluble, and next one is fat soluble. In the fat soluble, A, D, E, K is the vitamin A, D, E, K are the fat soluble vitamins. Water soluble, vitamin B12, thiamine and all will be there. No, so that one you just remember those things. Okay, so next one is that
functions.
Vitamin B2, B12, B6 are the Fat soluble. After that,
RDA.
functions. Okay, so functions and RDA. Okay, in this form you study means definitely you are going to be remember easily, and you can able to tackle any questions they can ask. Okay, so next one is minerals. Minerals also we have to see the classification. Major minerals and minor minerals. Major means that major is that calcium, phosphorus, sodium, potassium, and magnesium we want, and the trace minerals. Okay, so the trace minerals, minor minerals, and there also functions, dietary sources, RDA we should study. Okay, so after that 7th unit, okay, once you finish the 6th unit minerals, the very important topic is that one second. Yeah, minerals. After that, balanced diet. Okay, so most of the time there is a chance to get the question from this particular unit. Okay, so most of the time we got that what define balanced diet, explain about the balanced diet. Okay, so or else they are asking about the balanced diet for different age group. Okay, so like this adolescent group, adolescent girl, okay, lactating mother. Okay, so a lot of things they used to ask. Okay, the next thing we have balanced diet, definition of the balanced diet, then after principles, okay, food guides, basic 4 food groups,
and then calculation.
Yeah, the calculation, narrative value of foods, and dietary fibers. Okay, so next thing is that this one will going to be helpful to plan the nutritional life cycle. Okay, nutrition across the life cycle, meal planning. Yes. Okay, diet planning,
diet in pregnancy, nutritional charting.
See, nutritional deficiency disorder. After the balanced diet, what students are going to be discussed? So they are going to be discuss about the balanced diet. Okay, what is this balanced diet? Already we had told. Okay, so for maintaining the proper body, we have to follow the certain principles of the balanced diet. Okay, so to balance the proper body energy level. Okay, so the next one is nutritional deficiency disorders. Okay, so
in that, protein, energy, malnutrition.
So nutrition deficiency disorder means what? Decreased level of nutrition amount will be going to cause the nutrition deficiency. Deficiency means decreased. Okay, so there is a lesser amount of intake of the food. Which will be taken, or the nutrition will be taken by the human. Okay,
it may causes the deficiency.
So that will leads to lot of deficiencies like protein energy malnutrition, in that kwashiorkor, marasmus we have seen, and anemia. Okay, so due to the lower intake of the vitamin deficiency, lower intake of the iron, iodine. Okay, so
calcium deficiencies.
So if you are having a vitamin A deficiency, we used to see the night blindness. Okay, B deficiency, very C deficiency, scurvy, and D deficiency, rickets and osteomalacia are the most common. So D deficiency, where we can see which humans, for example, you have seen that keratomalacia is also there, that osteomalacia and bone related whatever the things, nowadays everybody is getting that one. So but in common, Muslims peoples are most prone to get this vitamin D deficiency. Why? Because they used to use the parda system, they used to underwent the parda system. Okay, so like that you have to remember the things. Okay, so the next one is mineral deficiency disorders like iron, iodine, and calcium deficiencies, and this causes, okay, which causes iodine deficiency causes thyroid problems, and iron deficiency causes anemia problems in the adolescent girls. Okay, whatever the signs and symptoms, there is a decreased level of hemoglobin in the blood. Okay, so that things will be there. Symptoms and management and prevention, and the nurse's role. What is the nurse's role? So we are the nurses, we have to provide a nutritional education to the people to overcome from this. Okay, so why? Because nutritional malnutrition, that is what malnutrition. due to the lesser intake of the food, what it will be happen, there is a lot of disorders, that what we have told, no, especially who are the vulnerable group, my dear students. So the vulnerable groups are like, who are the vulnerable group? So the vulnerable groups are like, they are having pregnant women, okay, and we have the adolescent girls, especially infants, okay, and under 5-year child, okay. So those are the vulnerable groups that we can see that. Then therapeutic diets. What is the therapeutic diet? Therapy means treatment, okay. So the therapy means treatment. So here in the therapeutic diet, so we are going to plan the therapeutic diets, okay, related to the hypertension, related to the diabetic, related to the lactating mothers, okay, cardiovascular diseases, underweight, diabetes mellitus, hepatic disorders related to the liver, constipation, diarrhea, pre and post operative period. We have to modulate the diet according to the patient condition. So that's we are going to study under the therapeutic diet. Far more sure, either 5 marks or 10 marks question will be definitely taken by the this unit, therapeutic diet. Either it may be prepare a balanced diet for prepare a therapeutic diet for the diabetes mellitus patient, prepare a therapeutic diet for the hypertensive patient, okay. Or it may be they can ask that prepare a therapeutic diet for the lactating mother, okay, pre and post operative patient, okay. So and we can expect that hepatic disorders, okay, for them we have to prepare a therapeutic diet. Either most chance, most they can expect, we can expect from the diabetic and as well as the lactating mother, pregnancy, antenatal diet. Then after what we can expect, hypertensive, diabetes mellitus, antenatal, next diarrhea for them and all, okay. So here and we are going to speak about means learn about the feeding techniques also, okay. So these are the very important things which we can able to study in the therapeutic diets, okay. So the next one is cookery, okay. So 9th unit is cookery and rules and preservation of the nutrients, okay. So how we can able to preserve the food and how we need to cook, whatever the steps, methods of cook, boiling, frying,
and what are
simmering,
the advantages, disadvantages of cooking.
Yeah. Next one, preservation of nutrients, measure to preserve the loss of nutrient during the preparation, okay. So
and
we are
storage of the foods.
Especially we are cooking, what kind of cook we are using? Boiling method. In that also pressure cooking we are doing right now. So all the nutrients which will be there in the food, which is going to be evaporated. So there is no use, okay. So for that certain reduction of the nutrients in the food, so we have to follow certain different methods, okay.
Food preservation.
Yeah, food preservation not. So that is a method how to cook, okay. So the next one is that we have the food preservation, how to preserve the food, okay. And what are the safe food, safe food handling and storage of the food, where you have to store and how you have to store, okay. What kind of cleanliness you have to maintain over there. So that is very important. The next one is food additives and
food adulteration.
So this is very important and you have to know this one, ma'am. We know that, right? So whenever we are going to see about this food additives and food adulteration, to increase the quantity and making the money purpose, they used to do this one. So best example, first example we can tell that metallic yellow which will be used in the turmeric powder. Okay. So the next thing where we are using
in charts.
So we are using in the mustard seeds in the ragi. Okay, so ragi will going to be mixed with the mustard seeds. Okay, so the next thing we are using this adulteration means milk water. Okay, so that is the very common that more amount of milk will be mixed with the more amount of water will be mixed with the milk. Okay, so this is how you have to. You have any doubt in this? Please do comment while are watching. So the next one is that nutrition assessment and nutrition education. Objectives of the nutrition assessment. Okay, assessment. What is this assessment? Assessment means assessing the things, nutritional needs of the person. Okay, so I am going to assess you to know that how much amount of nutrition you should need. Okay, so that then there it is, objectives will be there and methods will be there, and clinical examination, anthropometry means height and weight
Laboratory
measurement
and the
we need to take.
biochemical assessment.
Yeah, by laboratory and according to the laboratory test. Okay, so whatever the test, cholesterol, HDL, LDL, and everything they have to see. After the conclusion, they are going to provide you, assess the nutritional need.
Dietary intake, including the food frequency,
questionnaires and method, nutrition education purpose, principles and methods, how you need to provide a nutritional education, why it is important, you know. So food is the medicine and medicine will be the food, my dear students. Once the Charaka Maharshi said this one. Okay, so if you have a proper food every day, proper maintenance of the water, okay, so everything will be balanced. Okay, otherwise if it will be a malnutrition, either it may be overweight or it may be underweight. Okay, so the next one, national nutritional program and role of a nurse. Okay,
nutritional problems in India. National nutritional programs. Nutritional problems in India and national nutritional policy. In national nutritional programs, what are all the vitamin supplementation and anemia mukta bharata program and integrated child development schemes and midday meal scheme and national iodine deficiency control program and iron and folic acid supplements and
okay,
role of nurses is very important. In the
see, we have lot of programs in the national nutrition programs. Okay, so national nutrition programs are the programs which we are taken by the Ministry of Health and Family Welfare by the Indian government. Okay, so why it is the initiative by the government means to eradicate the malnutrition among the various vulnerable group in the community. Okay, so in that first things which we can able to know is that nutritional problems in India. What are the nutritional problems we can see in India? Anemic, okay, anemia problems we have, and we have the problems like
iron and folic acid
deficiency that will leads to the anemia only. Okay, next
iodine
one is that
national iodine deficiency.
Yeah, iodine deficiency we will see, and lot of other problems will also will be there. So there is a certain reasons also there. Okay, so economy is also one of the biggest reason that we are not offering a good food and food adulteration, and due to those kind of things we are not getting the food properly. Okay, so the next thing is that we have a national nutritional programs like vitamin supplementation, anemia mukta bharat program, integrated child development services, that is what ICDS. Okay, have you heard about this Anganwadi workers? Okay, so Anganwadi workers will going to provide the nutrition to the people like pregnant women, adolescent girls, and as well as the under 5-year child and infants. Okay, so for these people they are going to provide the nutrition. What is the purpose of providing them? To make the people or to eradicate the malnutrition. If the child will be malnutrition, certain deficiency what we have discussed, no, so that kwashiorkor, protein energy malnutrition, marasmus. Okay, so those are will going to be affected. The next one is midday meal scheme. So this is one of the very important nutritional program
in
that
school life.
It was introduced in the school. Okay, so why because to provide a nutritional needs of the school going children. Okay, so those people also
need nutrients.
Yeah, next one is that national iodine deficiency. Okay, so whether you have observed ASHA workers will come, no, so whatever the words I'm using, no, most of the questions will become there only. Okay, so what is the full form of the ASHA worker? Accredited social health activist. Okay, so expand ASHA, like that they used to ask, or what is the role of the Anganwadi worker? Okay, so these are the important questions. Remember these. Okay, so the next one is that disorders, iodine deficiency disorder control, NIDDCP. Either they may ask like this also. Okay, iron folic acid supplementation, WIFs. Okay, so newly weekly So this one was weekly iron folic acid
Acid
supplementation,
supplementation.
WIFs, and other
Role of-
as introduced. Okay, so a lot of programs are introduced. So what is the role of nurse in this? You can write educate the people. So nurse will be act as a educator. Okay, so the next role is that she has to conduct a certain programs in the community to educate the people. Okay, so that she will be act as a leader, she will be act as a what we can coordinator, okay, and educator, and she will be act as an advocate, okay, so counselor. Okay, so these are the role of the nurse. She should take in place and successfully she has to tell about this one. Okay, so these are the things. Okay, so the next thing, before going to waste my time, I would like to tell about the so this one we will discuss later. Okay, so I will teach you how to write the exam. Okay, by the time I will discuss that one. So now you can see that, ma'am, we were now going to discuss about the question paper pattern. Tell about the question paper pattern. So we have the question paper pattern. Okay, so first freshly who are writing this examination, no, you should know that the question paper pattern, we have the longest type of questions.
Short essay. Short essay, MCQ questions.
Short answers. Short answers we have, and we have the
MCQ questions.
multiple choice questions. Okay, so my dear students, first freshly who all are writing, no, kindly watch this full. Okay, so first question is that how many marks? 50 marks. How much you want to secure? Aggregator, about 25 marks you have to secure, half of the marks. Okay, so that does not show for me, but half of the marks we need to secure here. Okay, so remaining 25 marks you are going to write for the applied biochemistry. Now I will tell you the long essay format questions. One question you are going to write for the 10 marks. Here 4 question you are going to write for the 5 marks. 10 plus
20.
Yeah, this is 20. Okay, next one, short answer, we have 6. Okay, 6 question. Here also we have a 6 to 7 questions will be there. Okay, 12:30 to here I think 8 questions we have. Okay, so total 50 marks. Okay, so what you have to know is that things how you need to write the examination. First I have told you that 50 marks paper will be there. Okay, and we know that the what type of questions will be there: long essay, short essay, short answer, and multiple choice questions. Okay, so where you have to focus right now. Okay, so now I will teach you that one. So remember this one. Okay, so here you can see this is the paper. Now already all are attended for our yesterday session. You already know that we have a lot of doubts are cleared. Okay, so if you have any doubt you can comment it down over here. That so one second. Off. Okay, So the question paper pattern we know that, and now we are going to see how we need to write the examination also. So all the doubts we have cleared over there, that whatever the doubts you have yesterday, no, so what is the answer sheet pattern, that and all we have already cleared. Okay, so now we can only see that the things which is very important to know, you have to put the question number, okay, before going to write the answer. Long essay form of question needs more answers, okay, because it carries 10 marks, okay. So the 10 marks will be there, no, so for that reason you have to write more, okay. So more you have to write, okay. So that is why you are going to write according to introduction, okay. Suppose they are asking one question, you have to write the introduction, then definition, you give a 2 definitions, 1 and 2 definitions, and according to whom you need to write, okay. So if you study thoroughly, definitely you are going to write it down, that, okay. Next thing is that elaborate your answer. Suppose they are asking about the see, listen. So here I have written one question, okay, introduction to nutrition, okay. So in this particular unit, one question I have wrote here, so that we can discuss, okay. So that is the first unit, okay. So first question which we can able to know that, the question which is how we need to write, okay. So how we need to write means, first question, the nutrition, the science that deals with the food and utilization by the food for growth and maintenance, repair and energy production. So that is the thing we should know, okay. So definition you have to write in this form, okay. So put a heading and write the definition. Before that you have to write the which one, introduction, okay. So the next thing you have to go with the things what you want to elaborate, importance, okay. So importance, aims of nutrition. So the next thing which is we have the nutrients, okay. What is importance? To provide the energy, to maintain the energy level, we need a nutrition. So to avoid the malnutrition, we have to focus on the nutrition, okay. So that is why nutrition is very important. To sustain the balanced life, nutrition is very important, okay. In such a way you have to write it down by one, okay. So one by one you have to write it down next to this particular heading, okay. So the next one is aims of nutrition, that you already know. Now we are focusing on the nutrients, okay. What are nutrients? Nutrients are the substances in the food that necessary for the growth, maintenance and normal functioning of the body, okay. So for maintaining the normal functioning of the body, what we need to do, we have to take the nutrients. Where it will be there? It will be there in the nutrition, by having the food, okay. So food is the substance, okay. So it is the substances in the food, okay. So in the food we have the substances like carbohydrate, proteins, energy, okay. So fats, okay. All the nutrients will going to be provide energy to maintain the function of the body, is called as nutrients, okay. So you cleared with this. Next we will go with the two types, okay. So we have majorly, why I am writing here like this, because this is the example answer for you, make you to know that better about how to elaborate your answer, okay. Understood? So the next thing is that macro and micro, two nutrients are there, okay. So macro means it is required in a large amount, is called as macronutrients, okay. So the next one is that micronutrients. So the micronutrients are the nutrients we are required in a smaller amount, even if there we need to have that, but if it is not there, we should going to be take that one, okay, but not more than this, okay. So the next thing is carbohydrates, okay. So macro will comes carbohydrates, proteins, fats, okay. So carbohydrates per gram we have the 4 kilocalories. The next one, proteins, we have the 4 kilocalories, and the fat we need to 9 kilocalories per gram, okay. Next one, micro minerals. micronutrients. The micronutrients are like vitamins, and we have that.
And it required in a small amount.
Okay, so whatever the doubts you have also, you can comment it down in the Instagram too. We are going to clear for that. Okay, so whatever the doubts regarding the tomorrow's exam, you should comment over here. Okay, so everyone watching, right? Or have you heard any kind of disturbances in the audio? So we have to, one second. It's okay now. So what will be happen? These are the examination answer writing skills. Okay, so here it is macronutrients and micronutrients. Same like that carbohydrates classification is also they are going to ask. Okay, explain regarding the classification of the carbohydrates. By the time what you have to do, monosaccharides, disaccharides, polysaccharides, oligosaccharides. Okay, so one by one you have to write it down. Okay, so next thing, we have that functions of the nutrients. The carbohydrates, what it will be do here? The carbohydrates will
of energy. Carbohydrates are the main sources of energy and protein sparing actions.
Next one is proteins. Okay, so before going to that carbohydrates, we will elaborate. Okay, so you have to know while remembering and recalling, you should know this one, main source of energy, where we will get what are the sources of carbohydrates. Rice and all will be there, no? So must and should every day we are having the rice. Okay, so the next thing, protein. Okay, protein sparing action will be taken place by the carbohydrates only. Okay, so the next we have the proteins. So mainly proteins, we are going to see about the 8 essential amino acids. Okay, so proteins are the building blocks of the energy. Okay, so next one we have that
growth, repair and tissue.
So for growth and development, for repairing the tissue, for immune system, boosting the immune system, which is important, protein. Everybody will telling in the gym, no? So most of our students will go for the gym. Ma'am, protein requirement, egg ma'am, egg, like that they used to buy and they will eat. Okay, so protein requirement we were getting by the egg and the chicken. Okay, so the next one is formation of enzymes. Okay, enzymes are the chemicals which will be present in the our body utilizing for the energy consumption. Okay, so the next one is hormones and antibodies. Antibodies which will present in our body, so which will always going to fight against the immune system, which is going to affected by the antigens. Okay, so what we will call antigen antibody reactions? Phagocytosis. Okay, next one.
Next one is a fat, concentrated source of energy, and it helps in the
absorption
of fat soluble vitamins like vitamin A, vitamin D, vitamin E and vitamin K, and it provides insulation and protection. Fats.
So fats are the concentrated source of energy. Okay, so how it will be? Concentrated source means water whenever our body is required. Okay, if you're not eating one day also, you can survive. No, how we are going to survive? In our body we have a stored fat. Okay, starch will be there. Okay, so whenever we are requiring, that fat is going to be enact. Okay, so that is actively worked and we are sufficiently get the energy. Okay, so 1 or 2 days we are not having food also, we are survive. Okay, so that is what concentrated source of the energy. Already it is concentratedly so stored in our body. The next one helps in the absorption of fat soluble vitamins. Whatever the consumption of the nutrients which will be present in our food, like vitamins, whatever there,
vitamin E,
A, D, E, K, fat soluble, especially vitamin B12 and all, it is a water soluble vitamins. Okay, whatever the vitamin B12, B6, B2 will come, no, so that is water soluble. Only fat soluble vitamins which we can able to easily absorb in the form of fat. Next one provides a insulational protection. Okay, so insulational protection is that. So insulational protection, which is going to provide the insulational protection. The next one, vitamins. Vitamins are going to be
regulate the body
process and protects from
the deficiency diseases.
Yes, why vitamins are very important? Vitamin B12, okay. So lot of people will come, especially this aged people. Have you noticed that they are a vulnerable group to have the vitamin B12 deficiency, okay. So they used to tell, madam, I am having lot of bone pain and like leg pain, knee pain, and especially lactating mothers, they too lose the vitamin B12. The next one, we have the things which is related to vitamins, like who are not having the source of vitamin A, that they will definitely going to see that night blindness in the people, like child, okay. So especially they used to wear the lot of glasses and all in a very younger child, no. So that will be due to the vitamin deficiency only. So that is the functions, okay. So which is protects from the deficiency diseases. We are taking lot of vitamins, means definitely we can boost up our things, okay. So the next is
Minerals.
minerals, okay. It is the building blocks of the bone and
Bones
the
and
teeth,
teeth.
okay. So the teeth, so minerals are the builds bone
Bones
and
and
teeth.
teeth.
Okay, so how it will be build the bone? So especially the calcium, okay. So calcium, phosphorus are the minerals, right? So the calcium which is going to be helpful to build the bone, okay. So what we need for the bone health? The calcium, right? So that is why the doctor will be advised to drink more plenty of milk. Where we will get, what are the sources of the calcium, okay. So the next one is that regulates the body
functions
fluids and
and enzymes.
Okay, so to maintain the body fluids, our body is fully filled with the water, okay, which means 75% or filled with the water in our body, okay. So that needs to balance, okay. So and the enzymes regulates the body fluids and the enzymes. These minerals are going to be helpful. The next one, water. Water is the medium for all the body reactions, okay. So and helps in the digestion and absorption. So if you are having a lack of water in our body or intake, that will leads to lot of disease conditions like dehydration we are experiencing, okay. So you are having a diarrhea, keep on your body will going to lose a lot of fluids and electrolytes from the body,
it
okay.
causes the dehydration.
Yeah, rehydration and dehydration will be taken place due to the diarrhea. So that is why you have to have a plenty of water. So for example, I'm telling, okay, like this you have to do the point wise, you have to elaborate your answer. Next one you can see
factors affecting the nutritional
status.
Factors affecting the nutritional status: age, gender, physiological state and physical activity, income, food habits, health status and education, cultural and the environmental factors.
So first one is that age, okay. So when it comes to this age, you know, so we have that. So age is the first thing, right? Okay. So based on the age also, old age people, they are not having the lot of energy to metabolism, okay, to take the food, and they can't able to digestion and absorption level will be very less for them. And for example, infants also, okay. So that is why we are providing the milk to the infants, mother milk, okay. So breastfeeding and all, okay. So that is very important. The next one, gender. Okay, based on the gender also, the factors of the nutritional status will going to be affecting. Then
Affecting.
physiological state, okay, physiological, the functional state of the human
Human
body, okay, that is also affecting. Physical activity, so I will explain you malnutrition will come, okay. So you can think that malnutrition again divided into two: undernutrition, overnutrition. Undernutrition means less intake of the nutrition and less digestion of the nutrition absorption will be taken place inside the body right now. So the next thing what we are going to see is that we have that the thing which is physical activity less means overweight will be taken place, okay. So we are taking lot of nutrition but there is no physical activity, that will leads to obesity. Okay. Next one, income. Okay, income means so poverty. Okay, so poverty will going to affect that. If you are having lot of problem, financial problem, that will going to be affect you. Okay, so the next one is food habits. Okay, especially now we are going to be towards the fast foods. Okay, so lot of junk food we are consuming. Okay, so definitely that will going to, you may see that for 12 years, 6th or 5th standard, 4th standard girls are getting the menarche. Okay, so why? Due to the these kind of food habits. Okay, so that is why. Okay, and lot of people are getting heart attack. What is the reason? Their food habits. Yeah. Next one is health status. So this is also very important. That's what we are going to study in the therapeutic diet. Then cultural and environmental factors. Okay, so different type of cultures will be there, different type of, suppose for example some people are not taking a food at a proper time due to they are not doing the puja, they are not doing, they are culturally they have believing that they are following those kind of things. Definitely we are not taking a food at a proper time, what it may leads, it may leads to gastritis. Okay, so gastritis it will going to cause. Okay, so don't bother about anything, you have to have a food at a proper time, that is the thing. Okay, so these are the cultural and environmental factors. Okay, affecting based on the climate, also based on the climate the food habit will be going to be changed. Okay, so those are the things you have to remember. Okay, so now this much only. Okay, so this is how put a one conclusion and wind it up your answers. Okay, so that is how you are going to be finish it off your answer. Okay, for long essay like this if you write, definitely you are going to get pass in the examination. Now kindly take down that which is important questions. Okay, so now you take the important questions from the first to last unit. In generally I will tell the important questions, don't worry about that. Okay, okay,
define nutrition.
So the nutrition mainly we are expecting, already we have given in this Instagram, don't worry about that.
And then the classification.
Yeah, define nutrition, classification, factors affecting the nutrition. Okay, so here you can see that factors affecting the nutrition, they may ask for the 2 marks. Okay, so the next one is that
proteins.
So define proteins, classify the proteins
and explain their functions.
Okay, so define proteins, classify the proteins and explain their functions. Okay, so that is also one of the important question, far more we can expect that too. Okay, next one is explain the function, sources and deficiency disorders of the vitamins. Okay, iodine what vitamin deficiency we are having? Vitamin A deficiency, D deficiency, rickets, osteomalacia, regarding all those things. Okay,
vitamin deficiency.
Yeah, that you have to write it down. Next one, discuss the function, sources and deficiency disorders of the minerals. Calcium, okay, decreased calcium, decreased sodium, okay, hyperkalemia, hypokalemia. Have you know about that? Okay, so electrolyte imbalance if you study means those will comes. Okay, calcium related disorders or this bone related disorders you are going to see over there.
And then the next question is the
iron deficiency disorder. Okay, next question is that
principles of balanced diet.
So the principles of balanced diet, and we have that one more question from this particular unit only. Okay, one second.
Principles of balanced diet.
Yeah. So the principles of balanced diet, before going to that, I would like to tell about the one of the important question which is related to the balanced diet. Okay, so balanced diet means what? One by one we can going to discuss. Okay, so before going to that, from first unit you take that classification of food. Okay, so the classification of food you have to, like cereals, okay, which group it will come. Okay, so the next one, fats, okay, minerals, the classification of food according to the source of nutrition. Okay, so based on that, then explain the factors affecting the food and nutrition. Again I'm telling, explain the factors affecting the food and nutrition. Explain food groups. Okay, so that food groups we have told, no, so that one. The next one is explain functions of the food. What are the functions of the food which is going to provide energy to our body, balance the and maintenance the health of the human. Okay, lot of fun. The next one you have that role of nurse in nutrition and health. Okay, so role of nurse. The next one, define nutrition, define energy, and define nutrients and its classification. Malnutrition. Okay, malnutrition is very important. Undernutrition and as well as the
malnutrition.
Overnutrition. Okay, next one is that macronutrient. Okay, macro, micro. Okay, macro means what? Large amount of required nutrients. So under that we have seen the carbohydrates, proteins, fats. Next one, micro have you remember? That one you remember. Vitamins, elements of the nutrition. Okay, so that elements are important. Okay, so the next we have that. Okay, one second. So based on our units we can go. Okay, so the next one is that carbohydrates. Okay, so from the carbohydrates we have functions of the carbohydrates, factors affecting the basal metabolic rate. Then definition of the carbohydrates, classification of the carbohydrates, monosaccharides, disaccharides, polysaccharides, oligosaccharides. The next one is that
caloric value.
Caloric value and dietary requirement. Okay, next one, list down the sources of carbohydrates. Okay, rice. Then monosaccharides means what? Okay, one structured chemical bonding will be there in the mono means single. Okay, next one, BMR. Okay, that is very important.
Metabolic rate and
determination of the basal metabolic rate. Measurement of the basal metabolism. That too very important. Okay, so next we can see that. Before going to that, we have that basal metabolic rate means, for example, adult male is 50 kg, the body weight, oxygen consumption in 6 minutes is 1.1. Okay, so the heat produced in 6 minutes is 4.8 into 1.1, that is equal to 5.28 kilocalories. Heat produced in 1 minute is 5.28 by 6. Okay, so heat produced in 24 hours means 1000 to 6 7. Okay, so that is how you need to calculate. Okay, so that should be conducted before the breakfast. Okay, so certain principles will be there. Okay, then monosaccharides are the most basic form of the carbohydrates. Remember like this. Okay, so the next one, dietary recommended. One by one I will tell. This is very important. 0 to 6 months we want 60 grams. Okay, 60 grams. Then 7 to 12 months 95 grams will be there. And 1 to
8 years 130 gram.
So it is about 45 to 65 calorie percent according to the carbohydrate level. Okay, so according to carbohydrate as a percent daily calorie intake, 40 to 65%.
According to their age group. 9 to 18 years 130 gram. And 19 years 130 gram. And in the pregnancy 175 grams. In the lactation 10 grams.
So lactation and during pregnancy time we have to take little bit more than our daily recommendations. Okay, means daily in adulthood and all we are taking that 19 years plus means 130 gram is necessary. Okay, but when it is pregnancy and lactation we have to take a bit more. Okay, so 175 and 210 grams we need to take. Okay, so that is how you remember and write this daily RDA. Definitely they will ask. Okay, and BMR also. The next one is proteins. Okay, so in the proteins we are expecting the questions like define proteins, explain the digestion and absorption, metabolism and storage of proteins. Okay, next important question, functions of the
Functions,
protein,
yes.
classify proteins, and
And
protein
protein
energy
energy
malnutrition.
malnutrition.
Under that, undernutrition, and we have the overweight. Overweight means obesity. Okay, overweight, obesity will come. The next one is that undernutrition, protein energy malnutrition. Okay, so that topic you completely study protein energy malnutrition due to the lower intake of the nutrition that will causing. Okay, so that is what the low protein energy malnutrition. Okay, so that will going to cause the kwashiorkor and the marasmus. These two, either they may ask for the 2 marks question, define kwashiorkor, define marasmus, difference between the kwashiorkor and the marasmus. Okay, so and protein energy malnutrition completely they can ask for the 5 marks. Okay, so have you got now the important question?
And
Next
4
one,
good source of
yeah,
proteins.
4 good source like we
Animal
have the
source, plant source.
animal source and plant source.
Animal source are egg, fish, meat, and plant source are pulses, beans, soya beans, like that.
Yeah, we have that animal source, plant source. So in the animal source, we are going to consume that eggs, meat, chicken, okay, then beef, everything we are getting the protein. Okay, animal, that is animal. Plant source means plant source, that whey protein, what we are calling, no? So that protein we are going to consume by the, get it by the
pulses. Soya.
Next one, very short answer. So short answer type we are expecting. Give the example for the complete proteins. So amino acids, list out the amino acids. For what are amino acids? Give 4 good source of proteins. List out the functions of proteins. What is the daily requirement for the protein in the adult? Okay, so we have that 30 grams per day we need. Then next one is write about the deficiency of the protein with the preventive measures. Okay, so this is all about the third unit, proteins they may ask. Okay, next
Fats.
We have fats. Fats also functions they may ask, sources may ask, classification of the lipids. Okay, so that is the thing which will be there. Okay, so here you can see on the basis of chemical composition the classification of the lipids, simple, compound and derived. In the simple we have fats and oils. Derived means steroids matte fatty acids. Okay, so next one compound means phospholipids, glycolipids, lipolipids. 3 will come. Okay, so like that you remember, put a one flow chart, then write it down. Okay, fats and fatty acids, saturated fats
and unsaturated fats.
So next one is that saturated fats means animal fats, butter, curd. Okay, so those are the sources. Then next one, polyunsaturated fats. Unsaturated fats again going to divide it into polyunsaturated fats, monounsaturated fats. Okay, poly means
polysaturated.
Polyunsaturated fats again 2 types.
Omega-3 fatty acids, omega-6 fatty acids.
Okay, omega-3 fatty acids and next one is omega-6 fatty acids. Then corn oil, sunflower oil, then we have omega-3 fatty acids by the fish. Okay, so a lot of fishes only you are going to get it. So the next thing, so next one we have the questions like functions of the lipids. Okay, so what are the sources? Sources are like avocado, cheese, dark chocolate. So from those things we are getting that one. Okay, so these are the very important questions. And next thing, vitamins. Describe dietary sources, function, classification, especially deficiencies and hypervitamins of vitaminosis of the fat soluble vitamins. Okay, that EDEK you have to completely cover it off.
And then daily requirement deficiency, water soluble vitamins.
That one, vitamin B. Okay, so B oriented vitamins are the water soluble vitamins, thiamine. Okay, that one, vitamin B12. Next one, riboflavin. Briefly explain the functions, dietary sources and dietary requirements of vitamin C. Next one is that very short answer, classify vitamins, thiamine, functions of iodine, hypervitaminosis. Okay, hyper means increase. Okay, so that is all about the vitamins. Next one is that after this vitamins, we have the water. Okay, so one second. Minerals. Okay, so before that minerals. So after classify minerals, again functions. Discuss about the functions, absorption, metabolism of calcium. This is very important. Okay, calcium is one of the very important question in the particular unit. And next one is
dietary sources, daily requirements,
and deficiencies of the iron. Next one,
functions of the phosphorus sources.
Mention the sources and functions of the phosphorus. So the next question is that
list out the macro and micro minerals.
List out the macro and micro minerals. This is also one of the very important. Either they may ask list or they may ask for the differentiation between the two. Okay. So next one is very important. You just take it down. Definitely we will get the question from 10 marks. Okay. So importance of menu planning for the pregnant woman. Plan a menu for sedentary pregnant woman. Sedentary lifestyle who is following, for her we need to plan a pregnant menu. Okay, so
discuss the steps involved in the planning diet. Discuss the steps involved in the planning diet for lactating mother and the
prepare the menu plan. Okay, so the next one, lactating mother. I will tell you one thing in the balanced diet. One menu for pregnancy must should study. Then lactating mother, that also you have to study. Then balanced diet and the role of define balanced diet, role of the nutrition in maintaining the health, food exchange system, factors affecting the meal planning. What are the factors? Okay, we have to plan according to their health status also. What is menu planning? Explain the steps involved in the menu planning. Okay.
And diet in pregnancy.
Yeah, diet in the pregnancy. So that is very important. In that, one thing I would like to tell about this one. Okay, only 1 second now. So the fourth question is that it is all about the menu planning. Okay, so in the short answer we are expecting that one. Okay, so the fourth question we have the menu planning or the meal planning, factors affecting the meal planning, nutritional adequacy, and we have that
meal planning.
Yeah, meal planning, and it's 1 second. Here we have what is menu planning is that menu planning is the defined as a simple process which involves the application of knowledge of food, nutrients, food habits, and like and dislike to the plan. Wholesome means holistic, okay, and attractive meal. So that is the definition. So aims of menu planning is that to fasten recovery of the patient and as well as to plan the meals within the food cost
to provide the variety of the food.
Yeah, different variety. Every day same variety we are providing.
Money,
it is not
time
good.
And energy.
To improve the quality of food.
To improve the appetite so that the maximum diet is consumed and wastage is minimized.
Yeah, that is the only thing which we can able to do it. Okay, so that is the menu planning. We according to their circumferences we are going to plan the menu to make the patient to be quickly recover. Okay, so that is the next one is 8 unit. We are going to expect the questions like list the key concept or differences between the kwashiorkor and marasmus that I already told. Explain the role of nurse in iodine deficiency disorder. Mention the deficiency of phosphorus again here. Explain the vitamin D deficiency in children and adults, osteomalacia and vitamin D deficiency. Okay, rickettsia. Okay, so that one, vitamin A deficiency disorder, night blindness. Okay, so that aptomalia, sorry, that is related to eye only. Okay, next one, vitamin C deficiency, which is the vitamin C deficiency we are expecting. Scurvy. Okay, next one is pellagra. This is very important. Calcium deficiency, obesity, hyperkalemia. Okay, scurvy. Hyper means increased level of the potassium in the body blood. Okay, so that will body fluids. Okay, so that will going to cause hyperkalemia. Okay, next one is scurvy. That is the scurvy means vitamin C deficiency disorder. Keratomalacia. Okay, so the next one is that megaloblastic
anemia.
megaloblastic anemia. The next one, mention the causes of osteomalacia.
Malacia.
Next one, what are the causes of anemia?
Anemia.
Iron deficiency is one
Yes,
of the cause, economy, poverty. Okay, so the next one, loss of low nutrition level. Okay, so that you have to write it down. Okay, next we will see the 9th, therapeutic diet. What is therapeutic diet? Write briefly on modification in therapeutic diet. Define the therapeutic diet, and we have that.
Role of dietary fiber.
So, role of
Dietary fiber in prevention and treatment of
cardiovascular
the
diseases. Role of dietary fiber in prevention and treatment of the disease, and diet in constipation, diet in diarrhea, diabetes mellitus, renal failure. Okay, so this one will compulsory 1 question 5 marks fixed. Okay, so take it down. The next one we have that 10th unit, cookery rules. Define cookery. Cookery and explain the methods of cooking. Next one, define food preservation. Write the principles, methods of food preservation. Okay, so that you have to write. List the purpose of cooking, why we need to cook. Safe methods of handling the food, and effects of cooking on the nutrition. Food additives. Okay, and enumerate the classification of the food additives. Whatever the things they are going to. This is very important. Okay, food adulteration must and should study and go. Next, write a note on the food adulteration. Household methods of preservation, prevention, and of food adulteration, PFA. Okay, so and food standards. Next, food additive. Define food preservatives, food adulteration, roasting. Define poaching, bring the advantages of it. Steaming, grilling, food safety. Okay, so this much is covered with the particular unit. Okay, so only take the important questions. Most of the things you already studied. Nutritional assessment, 11th unit. Explain nutritional assessment. Describe the role of the nurse in the nutritional assessment. How you have to assess that one, you have to elaborate. Okay, we have to take the data first. Okay, so then only we can come to know the what is the need of the nutrition for her body or the patient body. Okay, methods of nutrition education. Write the role of nurse in nutrition education. Nutrition education we have to define, that is very important. Objectives and importance of the nutrition education, that is 11th unit. So for this much questions we can expect. Okay, so the next one, national nutritional programs. Explain the nutritional programs. Under that, goals of national nutritional programs, policy and midday meal scheme, ICDS program. Then role of nurse in the ICDS program, vitamin A prophylaxis program, anemia mukta bharat program, then WIFS. Okay, so weekly iron and folic acid supplementation, that program. The iron deficiency disorder control program. Must and should they can ask. Expand WIFS. Okay, so by the time you have to answer. Okay, so if you cover this much questions, so definitely you will get pass in the examination. Thank you so much for watching our videos. Tomorrow again we will come back with the community. Thank you.